You're listening to the Smart Policy Podcast, a production of the University of Tennessee's Institute for Public Service. From 2001 to 2011, as the prescription opioid crisis spiraled out of control, Kim Harmon, then with the Tennessee Bureau of Investigation, went undercover to bust pill mills, among other investigations into medical fraud.
The hardest undercover I ever did was in a legitimate doctor's office, and literally she walked outside that exam room and she said, "I am so tired of people coming in here asking for pain pills."
Shortly after she progressed up into a new role, however, her daughter Taylor's own actual struggles with substance use disorder began to spiral out of control. And suddenly this law enforcement officer, once tasked with imitating people with addiction in order to stop the flow of illicit pills, now had to figure out how she could help her own daughter find recovery. And yet, despite all of her experience and resources, it was not an easy road.
I was trying to weigh in on where is rescuing too much and where is trying to give somebody the space to help themselves. And it was hard when you don't know what is best.
I thought, she doesn't understand what it's like in here. She doesn't understand what I'm going through.
Taylor's struggles might sound familiar to many Tennesseans. Despite growing up in a peaceful childhood, a personal tragedy caused a tendency to overdrink into a full-blown disorder, closely followed by a problem with benzos, opioids, and other so-called hard drugs. Fortunately, however, her story of sobriety should be equally recognizable. She found a strong community of peers in recovery, and they have helped Taylor find her own path.
So I think that there is a whole lot to be said about resources being fellow people who are in recovery.
This is a fascinating, far-reaching conversation that touches on many topics. But if I had to boil it down, I might say that the big takeaway is that anybody and everybody is susceptible to addiction, and the most important thing we can do from a policy perspective is to make sure that people with substance use disorder have real access to resources that make a difference.
If those are your resources going in, they're your resources coming out.
I worked for TBI for 17 years, and 10 of those years were conducting Medicaid fraud cases, which included pill mills. I was there from 2001 to 2011, and then came to Nashville for headquarters. And when I started in that unit in Chattanooga, Tennessee, we were just beginning to look at doctors that were overprescribing. They would not require very much in the way of medical records or reason to prescribe as long as you had cash. I had other cases, but talking about the pill mills, when we first started, I would drive from Chattanooga to Nashville for the Assistant Director, William Benson, of the drug division at the time, to bring us all together to say, we've got a problem in Tennessee. We've got doctors who are taking cash and prescribing with no medical necessity. And we would try to decide what to do or how to approach it. And I would get kind of frustrated because I hate meetings without progress. I want action steps. I want to be told, here's what we're going to do to make headway. But, someone would say, well, a prosecutor may say, whether that was state or federal, well, we don't know what to do about doctors. They've spent 10 years in school. We can't prosecute a doctor. And so there was a hesitancy back again. This was back in 2001. We all saw the problem. We saw people that would go to the pill mills that would hang around for hours waiting to get their prescriptions. We saw that. And in fact, I did tons of undercover because nobody expected me as a female. I didn't look like law enforcement, and I could walk in any pill mill and give very little reason as to why I wanted. I'd ask for Norco, but very little reason as to why I wanted it. The hardest undercover I ever did was in a legitimate doctor's office. She asked me so many questions. I thought, well, I don't have that kind of backstory. I'm used to walking in and saying I have seasonal migraines and I need Norco, and they would just prescribe me anything as long as I had cash in hand. And I could take them just an old copy of an MRI or an MRA from having done an undercover somewhere else and say, here's my medical record. Now I want XYZ, and they would prescribe it almost every time. And again, the hardest undercover I ever did was a legitimate doctor who did a very thorough, had me walking on my heels and my toes and looking in my eyes and, checking on my reflexes. And literally she walked outside that exam room and she said, I am so tired of people coming in here asking for pain pills.
Hmm.
So she knew exactly what I was looking for, and she wrote me something like Toradol or something maybe that helps with migraines, and I got nothing of value. All the rest of the undercovers were so easy, but I say that to say that's how accessible it was to get a doctor to
Yeah.
write you anything. And I'll say the most egregious prescription I ever saw was a female brought in a mammogram report saying she had fibroglandular densities in her breast. And the doctor underlined it, diagnosed her with fibromyalgia, and wrote her tons of pain pills. And this was in a clinic where you could pay $75 if you drove 3 hours through several cities with other resources to go to this place in the middle of nowhere and get whatever you wanted. And that was, I thought when I was doing those investigations, I thought, I can even explain to a medically ignorant jury that this is wrong. You don't take a mammogram with this report and turn it into a nerve condition, a painful nerve condition of fibromyalgia, and they'll see that this is wrong. And so I think those started building. Of course, that at some point there's a federal law that if a doctor overprescribes and it leads to a death and you can prove that, then it's a minimum of 20 years. And we had one of our first cases up in Upper East Tennessee where that was found to be true. And this is just based upon my experience, is that we found that those doctors, whether it was that they had a pill problem themselves, an addiction problem themselves, so they would write prescriptions and have part of those prescriptions returned to them.
Hmm.
Or if it was about the money, because they could make a ton of money, cash, 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 $360 per month to see the doctor for cash. And then you could get your prescriptions from him and pay cash. And he had a sign inside of one of his cabinets that he knew exactly what was allowed, what street values were. Anyway, I had a friend that was a physician that would always say, Kim, I'm always worried that we're going to do something wrong. I said, we're not worried about you. We're talking about these folks who are intentionally prescribing. And again, we saw that it was either their own addiction or the money. And sometimes it was about sex. I mean, that they had, women or whatever that were around them that they knew exactly what would keep those women, coming back to them. There was even a federal agent that I had come to know that at some point he became addicted. As Taylor said, he had had surgery and then he slipped into this. It was not that he was dependent, but then became addicted. And that's when someone described this to me, and Taylor may say whether it's true or not, but is that any one of us has a lot of stress in life, just a lot of things going on. And if at some point you have a procedure and you're given a prescription for a legitimate reason after surgery, that maybe even like a hydrocodone, that it kind of helps you to watch your life like you're watching television. It allows you to detach from it. And if you just have a lot of stressors, it could be that someone falls into that because they're thinking, well, this helps me cope with everything that's going on. Did you see that to be part of the slippery slope? Or
Sure. I mean, I think it really is just, again, a side effect of I don't want to deal with whatever it is. And so you find whatever your DOC is that makes you feel the most detached or the most able to cope with whatever it is you have going on. It doesn't even have to be a huge life stressor. But I mean, once you've had a medical event or somehow wound up with benzos, opiates, whatever it is, that you have access to, if you just happen to get a perfect mixture combined with whatever a stressor is, it's extremely easy, to start using that to cope with and not have to deal with or feel the pain of. It numbs you emotionally, whatever your DOC most often is going to make you pretty numb emotionally.
So you mentioned DOC, drug of choice. There is something to be said about how there's a preference, right? Everybody has the preferred preference, but would you agree that at the end of the day, if you can't get that, you're going to get something?
Sure. So I liked opiates. They were useful for me at certain periods of my day. Depends on who you are, probably the chemical composition of your body. For me, just a little Roxy 30 was an upper. So
Hmm.
if by 3 in the afternoon the bar was open and I'd been drinking and doing Xanax all day, it was time for a little bump of cocaine and a little 30.
I bring all this up to say that the wave or phase of the overdose crisis we're in now is defined by combinations. I think it's a bit of a misnomer. I think it's always been combinations. In terms of where most of the deaths are coming from, I think we can talk about waves. You had prescription pills, especially when you were at your time with TBI, right in that peak window in the aughts and early tens. That was where most of the fatalities were coming from, and we've seen a steady trickle up as heroin and fentanyl entered the market, followed by stimulants. But really, I mean, when you get toxicology data, it's very rarely one or two things, and even simple things in the background like tobacco and caffeine. And do you think people get caught up in chasing one particular problem, trying to blame one particular substance more than just the broader problem of addiction, period?
What I saw is that I think everyone has the capacity to take this road.
Mm,
Again, when I mentioned that, there was an officer, there was an attorney, there were, folks that you look at, there was a church member, there was, I mean, you look at these folks and you think, these are just average people. These are not your folks that live rough lifestyles, grew up in this, you walk in their home and you think, oh, there's just like weed out on the table. I mean, people who are highly respected, they can easily fall down this road. But one of the things that I think Taylor has taught me, and I kind of alluded to before, is that every one of us have a closet. We better work hard to keep that closet clean.
mm.
In 2010, Taylor's uncle was killed by his son. He was 17. So my brother, he was ironing clothes in the living room, watching television, and his son had started dealing weed. There were different things going on, but the short of it is Taylor's first cousin pled guilty to voluntary manslaughter for killing his dad on that Sunday afternoon. That sent a family of 10, my parents, my brother's family, and our family of 4 into a spiral because we were just, again, not exposed to any of those things. I say I grew up in a fairy tale, and I don't know that we raised our girls in a fairy tale, but we had good lives. I think we had a good solid family, and then all of a sudden you have this tragedy, a homicide by a family member. And so Taylor at some point said that did cause more of this to spiral where she was. But a year later, I was at headquarters at TBI and was doing more training than the opioid stuff or the investigations.
Even before then, when I would drink alcohol like a normal 21-year-old, I would drink in excess. Normal people can, sip on alcohol. I never really had that ability. But then by 2012, alcohol and benzos being my favorite combination. But, when you do downers or like downers as much as I did, then you need something by 2 or 3 in the afternoon to wake back up because now it's time to go to the bar. The bar just opened.
Right.
So at that point, then I would do opiates, sorry, mama, some cocaine, things to wake myself back up to go to the bar to continue drinking. So yeah, I would say around by 2012, I was getting physically ill in withdrawals, TTs, as we call them, from alcohol and benzos. So that's the worst part, I guess. Then the good part is I went to my first treatment center in 2014. It was a year-long program. After I got out of that, I thought that I could be normal because we didn't know much about addiction in our family. I was a real Christopher Columbus pioneer, right? We just didn't know. Our family has been really, I'll say this and you can edit it out, but we've been, kind of like the Cosby family before Bill got weird. Or if you got a sense of humor, leave it in. But regardless, I grew up in like this picture perfect family. And so we didn't know very much about addiction. And to be honest, that first treatment center didn't teach me about addiction. It was faith-based. So with that, then, their perception was more of you can pray it away and less of this is how you prevent relapse.
Mm.
So even after my first treatment center, I would still have, kind of like benders, where I would still drink for 2 or 3 days. And once your body has become accustomed to benzos and or alcohol, or those two things combined, it happens very quickly that your body actually goes into DTs again. So within 2 or 3 days, of drinking just on a weekend, I'm sick by Monday, back in DTs. And so with that, one thing led to the next, and here I am again, my body physically dependent on either benzos or alcohol, preferably both. So with that, before my first treatment center, I had gotten 2 DUIs about, I don't even know how far apart, I guess 2 years apart. But by the time I had fallen back into addiction, or what I know now as relapse, then I wound up with 2 more DUIs, 2 days apart in 2017. So at that point, I guess I should maybe shorten this. We'll get into maybe some of it later, but regardless, call my mama, or my mom. I call mama from jail, at which point she refuses to get me out until she finds me a bed in a treatment center. So then I went to Cumberland Heights here in Nashville, where they do teach you about relapse prevention and what's really going on here for addiction. So with that, a couple more slip ups. Then my official clean date is October 30th, 2019.
Still coming up on 5 years, so that is a incredible record. You should definitely be proud of that. I have a quick question for you. How did it feel to be told you're going to stay in jail until I can find you a bed?
At the time, pretty upsetting.
Right.
I thought it was for, maybe not necessarily, I never thought there was a lack of love. But I thought there was a lack of understanding for sure. Like, she doesn't understand what it's like in here. She doesn't understand what I'm going through. I'm sleeping on this metal bed with a mat, a couple inches thick that you wouldn't even camp on. Now looking back, it was the most loving thing really she could have done. Obviously, we call it bring your bottom. You bring your bottom to them, right? So sometimes you will arrive at what is your rock bottom. Other times, people who love you help bring you to whatever that bottom is.
An interesting side effect, I don't know if this was the motivation, but the two most dangerous weeks in someone trying to recover his life, if they've been involved in criminal justice, is right after they've gotten released from prison. Tolerances reduce, and if you try to go back to your old dose, we see a lot of fatal overdoses that way. I don't know if that was your motivation, Kim, but may have helped keep her alive. If I may also, especially since at that point, fentanyl had overtaken the market overwhelmingly and was already starting to show up in counterfeit pills. So you might have, very plausibly could have been a situation where you thought you bought a Xanax and it ended up being fentanyl. It was a very dangerous time. It still is a dangerous time, but that we did start seeing the beginnings of that then.
Part of my, what I would always tell my girls growing up, that I would never bail them out. And the first time Taylor called us was however long ago, the first DUI, 2012. She was living with us. She had finished up college very successfully. She was Hope Scholarship, had graduated, had started law school, Nashville Law School. Very smart, hardworking kid. She's always worked so hard, made her own money, been independent. But she was living with us and was going to law school. And it was a Saturday night. She called and she said, it was about 11 p.m. She said, I'll be home soon. I'm headed home. And I went on to sleep, woke up about 2 a.m. only for her not to be home. I got up and I thought, well, I did not hear her come in, and checked her bedroom. She's not there. And it was very soon that I got a phone call from an odd number, but no one was speaking. And I thought, well, that was odd. And maybe even I got a second one, but it was enough to make me, I was working at TBI at the time. And so I called TBI and I said, can somebody tell me where this number came from? My daughter was supposed to have been home at 11:30 or so, and now it's 2 a.m. and she's not home. And that's when they told me that the phone call either came from they told me the county and the area, and that it was government property, and that it was either an ER or a jail and maybe there was a third. Within a short period of time, at this time, I even thought, well, somebody is probably about to knock on my door and it's going to be horrible news. Something's terribly wrong. And it was terribly wrong, but I thought someone's going to knock on my door and give me horrible news. And so when I called the jail, I may have called the ER first, but I did call a number or two. And when I called, then that's when I found out that she was there. And then she called me shortly after, and we talked for a short period of time. And I said, so it'll be well after church and lunch before I come pick you up, because she said, I'm not asking you to bail me out. I'm asking you to just pick me up. She said, I'll do everything else if you'll just come get me. But it was the first time we were in that situation. With the second one, I want to say in Ray County, we wound up going to court with you to general sessions, and her dad and I went, and maybe even your grandparents were there that day in Ray County. I'm not sure, but so then fast forward to the next time when we had been to a family reunion, and I did not know that the relationship she was in at the time. She said that this person had convinced her that she could just buy little airplane bottles and could pace herself for the weekend. Well, we were leaving East Tennessee from the family reunion, and she can tell you more, but she was driving in a separate vehicle. Well, somewhere along the way, I know we had talked, but then I could not get hold of her. And I just thought, and this had been a couple of 3 years since anything else had happened, but just being cautious and guarded. And at some point, I called, what county was that? Rutherford County.
McMinn first and then Rutherford.
That's right. McMinn was first. You wound up in a yard of an apartment complex there. But coming back from the family reunion, then I called Rutherford County and found out she was in jail there. That was a Saturday. She did call me, I want to say on Sunday morning, saying, get me out of here. I'm sleeping on a concrete floor, and on this metal, and whatever. And I will say that was very tough not to go get your child. But I called, we had friends that he was an officer and a jailer in the county we lived in. And I said, could you just tell me what I need to do as a parent? And he said, Kim, I promise you she's okay. If she came in and she was drunk, they have to check on her so many, so every so many minutes. They have to, she's got food, she's okay. And that gave me the calm I needed until that afternoon when we were able to go pick her up. So I don't know that it was because I knew that there were dangers. I believe we can always, as parents, we can always, what if, but part of what I was trying to do was have healthy boundaries.
Right.
I just seen so many people do so much for trying to rescue someone, only for that person to not take ownership of it. And Taylor has, if I can even chase this story for a second, is that, one of the days, she wound up with 4 DUIs. She wound up with an intoxicator in her vehicle for 6 years and eight years. We were talking on the phone, and she said, I've got to go get it calibrated. And I said, and this was many years into her being sober, but I said, I bet you're going to be glad to get that out of your truck. And she immediately said, Mom, I did this to myself. I'm just glad I did not hurt myself or anyone else. And I thought, that's my kid. She's gotten to that place where she has taken ownership. She knows where she's at. And so, going back to the days of getting phone calls from jail, that was hard, but I was trying to weigh in on where is rescuing too much and where is trying to give somebody the space to help themselves. And it was hard when you don't know what is best. You want to take your kids and those you love and just wrap them up in a bubble and say, protect them. And it's just hard to try to figure out, how do you balance loving without rescuing, because in the end, she had to take ownership of where she was, and she had to make those better decisions for herself.
For over a decade, you portrayed a person with a substance use disorder. I wonder if that experience played into how you dealt with Taylor's later recovery journey, or if it informed it, or what you might say to future members of law enforcement to consider, because when you were doing that work, you may not have had this. You don't have the same insight into addiction that you do now. And from what you understand about substance use disorder and the family perspective and everything, I mean, what could a law enforcement officer listening to this take away from this experience?
You know, I'm not sure, other than I think maybe a part of this being I was in law enforcement doing those investigations. My husband, Taylor's dad, is a pastor. I think you see a lot of folks, if you have parameters in your life, and we're making what we hope are safe parameters for our kids, creating these lives, but also when kids are growing up trying to figure out where they're going to push back, it may be that they tend to push back more. Um, there's been some things that Taylor said about law enforcement when she was in the thick of it, and she's smiling, and that I literally had to pause and not let that provoke something in me the best I could, because in her addiction she had a total disrespect for law enforcement because that was a parameter. And that's where I would circle back with parents. I think anyone who loves someone who you see their life is spiraling has to figure out how to love them and also have healthy boundaries. And I think there's not a textbook, there's not a prescription, there's not a outline, there's not a flow chart on how to do it. It's that constant of my husband and I had to decide the rules of our house are this.
We know there's certainly a strong medical and biological component to addiction. There are changes in the brain that occur with use of substances. Dopamine pathways in the brain, which affect our decisions, they get altered. But we've had other people in recovery on the show before talk about this, that there is a personal responsibility component. There's also a connection, a relationship component as well. I was thinking about how you mentioned Ray County, McMinn County, and Rutherford County. There's a transient nature to this and a lack of roots. This is something we've seen a lot with what happens with addiction. So Taylor, I wonder how did you get to this place? How did you get into recovery?
One thing that I've noticed, and there is no science behind it, but I will tell you that what I've noticed about people, specifically with opiates, who are addicts versus not, and maybe it's a strange thing, but I know it, I see it. People who take opiates, they've had a surgery, legitimate surgery. People who take them and they kind of it wakes them up and it kind of gives them a little bit of energy. I've never met one of those that's not an addict. People who take them and it puts them to sleep usually don't like them, and so it's just something that I've noticed. For me, I think it was once I got to the point of my body being physically dependent, I didn't recognize actually even what it was. I just know that I was waking up sick. I would shake really bad. I couldn't, by the point that I realized, and a friend told me that Xanax would take away alcohol withdrawals. Well, that was probably the worst piece of information I could have ever gotten. So by the time I realized that, then I started realizing not only do they take withdrawals away and you can go about your normal life. I had a Intoxilock in the truck at the time that I was even in addiction. And so I can't start an Intoxilock if I'm drinking, but I can if I'm on Xanax. And so if I had to go to work, and I knew I had to go to work, but I was sick every day, then I could get Xanax and take Xanax, and that would at least make me functional enough to get through a day or whatever of work. And so, but also once I realized that, then too, I realized that you can take Xanax and you can arrive at where you want to be, which is at the time blackout drunk,
Right.
much quicker. So, even at that point was probably in the worst of my addiction but trying to manage it. And there is a point where we all think, I don't have a problem, I can manage this. And so I would tell myself, I'm only going to take one football, which is a little blue Xanax. I'm only going to take one, and then I'm not going to drink until after work. Well, I'm sick by lunch. And so, I'm either taking more Xanax or I'm going home to drink vodka. But there was a lot of time spent, there is a lot of time for anybody you talk to in addiction that spent trying to manage it, because I didn't quite have a problem. I could still go to work, not clean and sober, but I'm at work.
Right.
And even then, with the next relapse before that next treatment, I knew I was waking up sick. And how am I going to go to work? Because at this point, I had moved to Nashville. I didn't readily have access to benzos just from a buddy down the street, and a buddy. None of them are really your buddy if they're selling you Xanax, by the way. But
Right.
regardless, I actually had gone to a doctor and I had gotten put on lithium, which is like a slow releasing benzo. It's not as slow releasing if you bust the capsule open and snort it, by the way. You can get it a lot quicker. So I found myself obviously doing that just to get through some of the withdrawals. So, but I will say, in finding recovery, going to Cumberland Heights, kind of having my eyes open of what it is, what the process is. Then you work the 12 steps. And to be honest, I think everyone on the planet could use a 12-step program. It's made me a better person than I believe I would have been had I never even gone through addiction. But, in each of those 12 steps, it teaches you how to be a better person to the core as a human, not just my drugs and alcohol use were simply really a side effect of some other things that I didn't want to address. Pride, anger, a little bit more pride, and a lot more pride, and probably a lot more anger. But regardless that I had these things that really as a human were wrong with me, that I was choosing to treat with self-medication. And so going through that 12-step program really teaches you not only one, I don't really get a choice like a normal person to sit down and drink a beer with their supper at night on a Friday. Well, I do get a choice, but I prefer to not wake up in jail. So teaches you, that you don't have, that's something that I don't have any control over. I'm not a normal person. I cannot do that. But then it also teaches you, hey, you've done quite a few things wrong to people who love you and you love. And so now what are you going to do about that? So really, going through the steps gives you a massive dose of humility, which is what was best for me. So, I think you have, if you're going to be successful in the way that I found sobriety, for me to have it and to have it successfully, I have to work it the most honest, true way. There are no shortcuts. There are no workarounds. There is, I did this and it was wrong. With that comes huge doses of humility. So, she says I'm honest and humble and all these things, but I don't have a choice really. If I'm going to work it and I'm going to get it and I want to live the life that I have now, which is amazing, and I want to keep the life that I have now, I have to do it honestly and humbly. And it is so much better. It's so much better way to live. I wake up and I feel great. I don't have to wake up sick and go search down the road for Xanax or pull in at the liquor store because they won't sell it to me until 7 or 8 in the morning. I just wake up and go to work.
Well, I really liked your point about how we do need to believe in something bigger than ourselves. And I think that takes many forms. I do personally think a spiritual component of that is important. I also think a community aspect is important. I think there's a lot of isolation and broken down so-called third place, home, work, and third place. We don't have a whole lot of third place anymore. And I guess what I'm getting at is there are a lot of different ways that this can look, but what I keep coming back to is recovery ecosystems, warm handoffs between places. You managed to arrange that. When Taylor, you were in jail and you were able to find a place that she could go to immediately after that. Not a lot of people get that. A lot of people get released from jail at midnight with no ID in a dark street corner or in the middle of downtown somewhere. And it's very tempting to return to drug use at that point, especially since it's probably right there down the street.
So I know that there are resources. The resources do exist. It's just about where do you get them? How do you get them? So I live in Dixon now, which has a phenomenal recovery community. It is incredible. We do have Celebrate Recovery in Dixon. There is actually a local meeting house that has multiple meetings a day. And so there are tons and tons and tons of resources. I have tons of friends that work in recovery, but I think there is a gap between when you've had some issue with addiction and then the side effect of that is a DUI, or you're arrested for possession or intent to resell or whatever you're arrested for. There is a disconnect between, okay, maybe you have a problem and these are the resources that you can use. So for sure there is something to be said about how do you find those resources. Then on the flip side of that, unfortunately, the resources do exist and there are still grant beds available because not enough people are ready for that change. So, even after my first DUI, or even the third DUI, even after those, I wouldn't have necessarily told you that I had a problem or needed to go to treatment somewhere. I'm fine. I've got this. So I do believe there needs to be an improvement with how do you connect people with those resources when they are ready for them. So you've got both sides of that coin.
I spoke recently with Sam Quinones, the author of Dreamland and The Least of Us. He very is focused on community development, not only from a prevention standpoint, from a recovery standpoint. He says we ought to think about this not just in recovery in the individual, but recovery of a whole municipality, a whole town, a whole community. But something else he said is we need to rethink our use of law enforcement. And he was referring to really the most severe cases, people who were chronically unhoused due to fentanyl or high-potency methamphetamine or something like that. And he saw the arrest as a blessing in a way, because if the drugs aren't going to kill you, the street's going to. Beatings, worse, happen all the time. I see y'all nodding. He's not saying go back to the war on drugs. He goes, the problem with the war on drugs is that we only used law enforcement. Because obviously you need your 12-step program, you need your faith-based communities, you need your treatment, especially if you have an opioid use disorder. There's medications for that can help stabilize people. But and then, of course, Narcan, so on and so forth. I could keep listing strategies tools we do have. But he saw it as, especially in the most severe cases, an opportunity to, and he goes, we don't do this a lot, not enough jails have these options, but say you have a recovery unit where you're in there not so much because, you've done atrocities, right? But that you could get some education, start working your recovery there, start seeing some mental health clinicians, depending on the case, that get linked with a follow-up program outside of jail so that the second you're released, you have follow-up and treatment options and things like that. He proposed a model like that. I was wondering if that spoke to y'all at all.
Yes, I would say specifically because usually when you are in jail, you are not using. Drugs do exist in jail.
Right.
They also exist in prison. They're in there. For the most part, you're at your lowest low. And so you're ready and willing to try something different. And then at that point, you're able to, with a more clear mind, get the knowledge of what exists and what your resources are. You're able to learn more. If you're in jail and you don't get those resources and you get out, more than likely you're going to call the last people that you were in contact with before you went there, which probably are part of the reason why you got there, right?
Right.
Not that it's their fault, but if those are your resources going in, they're your resources coming out. Unless we give them those resources in the interim of having a clear mind, then at that point, maybe they have an opportunity to be successful. But if you don't give them to them before and they just let me out, I'm in Rutherford County walking down the road, can you come get me tomorrow? I'm high again.
What do you think would make it easier for people to actually get these resources? You mentioned if becoming homeless is a breaking point for somebody, say, and sometimes it isn't. We see that often it isn't, in fact, in the days of hyperpotent fentanyl and methamphetamine that are just everywhere, as ubiquitous as alcohol now. I guess what I'm getting at is, what do you think could be done? And I don't want this word to be scary, but at the policy level, to make it more accessible to people? I mean, were there barriers you experienced? I mean, certainly something like getting released from jail with a connection directly to a program in the area, being made aware of programs, as we've mentioned already in this conversation. But just from y'all's experience, I mean, what could have made it more accessible?
I think there's two sides to that. One thing, as far as policies are concerned, and I do want to make note of all of the prescriptions that I did, from Xanax to 30s to anything, those came from a doctor. A doctor wrote those to somebody.
Mm.
I just happened to have buddies who, for whatever amount of money, would come off of them. So I think there is a lot to be said on that side of it. Is Xanax didn't just fall out of the sky in my front yard and I went out here and decided to snort a few, right?
Right.
Some doctor wrote those to somebody. So I know there is a side where people maybe do need some of those, but I also know that there is a side that is much larger and more abundant of, you can go right up the road and buy whatever you want to buy from somebody who is getting them from a legitimate doctor who did go to medical school. This person has this prescription that they don't take or are willing to come off of for a few bucks.
Yeah, the data does show that the first dose of an opioid, or I think 60, 70% come from a friend or relative. Do you think, I mean, I know the DEA does drug take-back programs and things like that, and some prevention coalitions do it, and now there's a whole lot of, I see you kind of smirking. So what does that say to you?
I don't know many people that are taking them back, to be honest, unless you're already in recovery or maybe you're a normal human, but you're not going to find people. It's a great concept, but the reality is, the people I was buying Xanax and opiates from, they're not the people that are just going to roll up at a police department, first of all. But second of all, they're not going to roll up and drop off free money either. Like, here, take this $300, you can have it. So I don't know necessarily. I mean, they're great programs to probably get them, like you wouldn't want a grandmother not turning hers in after her surgery was over, because here comes the grandson stealing them, so they
Yeah.
probably are effective for those types of situations. But the reality is that they're still everywhere. And there are enough places you can get them. If, Sue Bob doesn't have them, then, Billy Joe down the road does. They're available.
Do you think there should be some sort of incentive for drug takebacks?
I don't even necessarily know if that's the route. I do think there could, probably my best guess in my lack of knowledge or uneducated, probably on the criminal justice side, would be probably a little more investigation into maybe where these came from when they are found. So if I get pulled over and I have a couple Zanies in my pocket, they're just going to take those and maybe put me into the jail for a little bit. But probably if they're just floating around in my pocket, I didn't get them legitimately with prescription medication. If you have that, they came from somewhere, and they came from somewhere where somebody's either A, doesn't need them, or B, willing to come off of them for a few bucks or a lot of bucks.
Kim, do you have any thoughts?
One of the things that I thought of earlier, and you're talking about things that I think we can proactively do, is Taylor continues to live in Dixon because there is a very strong community here. I would love, she's an hour and 15 minutes from me. I would love to wrap her up in a bubble wrap and bring her close to us, and she could see us more often. And there's lots of pros to that. But I also know that she needs to be here in this community. They have such a strong network of folks that if something happens, they're helping each other out. I think that I'm going to describe myself for a second. I think for someone like myself who attends church, I'm going to sound so judgy, who attends church regularly, who has never had an addiction problem, who's never been arrested, whose pride or my closet is overeating or not exercising regularly, or are those things that do not, I can go to church and still say, hey, I've got my act together. I think until we start realizing that we all have flaws, and when we realize that we can help folks. Now, when it comes to addiction, I'm going to call Taylor. I mean, because I don't know that life. I have not been through what I call her hell and back, but I know that there's things that I can relate to folks. And I think the best thing we can do is just be human and kind of take the pride away and the ego away and think, we got to find out in this community what's going on. How can we build resources? How can we provide a place for Celebrate Recoveries to meet? How can we provide places for other meetings to happen and not have that stigma of, well, we don't want those folks in our building, because when they come to our building, they look rougher than us. They act rougher than us. They don't, their mouths may be saltier than us. And so I will say that I think there needs to be a very humane, humble, and community way of building something up. So proud of Taylor too, because a year, maybe 2 years ago, Taylor said, Mom, we need to write a 28-day devotion for people that either are going to a non-faith-based rehab or coming out of one, so that they have a resource. And again, it's based on, our flavor of faith. But, one of the stories that the name of it is The Prodigal's Return, I believe. Just so she has one close by, that it's just a little tiny book that we had. She designed it. It's got the first aid inside of the cross. And but one of the devotions that we even talked about over and over, of course, is the story of the prodigal son. And whether you're faith-based or not, there's that hope that child will come back and be restored to the family. And the beauty of the father wanting that so much that he runs toward the son in the story, wants that restoration. And then there's also, we have one of the devotions in there is the second son is standing there saying, but wait, I've been good all along. I've been, it's kind of that piety and that religious pride, if we're not careful, we have, when really we all have faults. We all have weaknesses. Not a one of us is perfect. And I think if we could kind of take that air about us off and just start helping people now, not blindly. Again, I think there's not a prescription. I think it's just when these opportunities come that people need help, we need to figure out how to do it wisely without enabling and help them in that way. Does that make sense?
If it helps, I think I identified 3 potential policies within there. 1, we should be humble, just in general. I don't know if that's a policy per se, but 2, have people in recovery at the table. You mentioned when you have questions about addiction, you reach out to the closest person you know who's in recovery. So people in recovery at the table of making decisions and with informed policies perhaps. And then 3, recovery community centers. You say if there can be a better place for community, for a grassroots, if you will, growth of a local community of people in recovery. So something like that potentially could have impact. Taylor, I saw you lean forward. I hope I didn't cut you off.
There was not a singular law enforcement officer who could have come to me with a badge and said, you have a problem, you need this, you need that, you can go ahead and chalk that. I'd just as well, box with you out on the front yard as you tell me anything about me and who I am or what I need or any of that. So I think that there is a whole lot to be said about resources being fellow people who are in recovery. Because we do exist. We don't have a high success rate. Unfortunately, there are overdoses. There are people who do continue in addiction. 10% of us reach long-term sobriety. And so we do exist. So many of us do exist that have worked the 12-step and want to keep working that 12-step of carrying the message. So I think it is a whole lot about who can you get to join you who may not be the prettiest face, right? This thing's been through a lot. And, I've got tattoos and I wouldn't sit next to a Catholic priest at a table and just eat supper. I sit next to a Southern Baptist one, but I wouldn't just sit next to, the governor or even, I don't sit at a table and look like the rest. But if this is your goal and this is what you're after, is to try to save people from addiction and overdose, you're going to have to invite people who might not look quite like you to be able to carry that message.
I guess we got another policy out of this too, is just more peer recovery. More peer recovery for sure. Well, thank you both very much for joining me on the Smart Policy Podcast. I really appreciate it.
We appreciate it too. We're honored to have your time, Jeremy. Thank you so much.
Thank you.
For more episodes on in-depth discussions on Tennessee policies related to substance use disorder by a range of local experts, please subscribe to us wherever you get podcasts and visit our website at smart.tennessee.edu. I'm Jeremy Corvelis. Thank you for listening, and see you next month.